Hi, I'm Steve Clemens, and I have a question. As coronavirus challenges society and spreads across America, what's the domino effect of keeping millions of students at home? Let's get to the bottom line. Across the U.S. so far, about 5,000 cases of coronavirus have been recorded, and restrictions are going into effect. One of the biggest decisions has been shutting down schools from coast to coast. People are more than happy to do what it takes to protect themselves and their families, but no one knows how the school shutdown will affect this generation of students and their parents. What happens if the school closures go beyond a few weeks? Does the entire term get written off? What happens if at least one parent can't stay at home with the kids? What happens to folks who depend on the free lunches and the breakfasts offered by the public schools? And with all the talk about distance learning, is America competent at scale to pull off such a feat? So many questions today. And fortunately, we're joined by people who have the answers, or at least I hope they do. From Atlanta, Georgia, Dr. Marcus Plescia, the Chief Medical Officer of the Association of State and Territorial Health Officials. From Vancouver, Canada, Mika McKinnon, a science writer focused on natural disasters and e-learning, or as she calls herself, the Master of Disaster. And in Washington, D.C., Mark McGee, the founder of the 50-State Campaign for Achievement Now, a nonprofit education advocacy group. But before we start, take a look at the sign of the times. Normally, the studio would be bustling with all of our distinguished guests, but now that we're in a time of coronavirus, our shows are virtual, and I appreciate my panel for going through this with us today on a new venture. Thank you all for being with us. I want to start with you, Dr. Plescia. I know that you're in Atlanta and that you interact on much more of a frequent basis with the Center for Disease Control than I do. What is the latest? How would you describe the dashboard of coronavirus and the social impacts today?
Well, the concern today is that we are continuing to see increases in cases of coronavirus across the United States. And what everybody knows has happened in the last couple days is we've moved to this approach called community mitigation. And that's social distancing. That's what we're all talking about. That's what we're going to be talking about on the show this morning. That's really about trying to find ways to keep people from coming into contact with each other. This is an infectious disease that's passed from person to person, and we need to shut that passage down. We need to find ways to really slow the increase in the number of cases that we're seeing. And that's what all the focus is on now. That's what the federal government is putting out guidance on. And I work with state public health departments, and we're seeing an increasing number of states now taking measures to try to keep their populations safe and try to get people to do that social distancing.
How behind the curve were we on this? You know, when you look at issues like testing, and you look at what South Korea has achieved, with upwards of about 300,000 tests, China upwards of a few hundred thousand more than that, and that testing seems to be such a key piece of responding to this challenge. Where are we right now? We hear about 2 million tests coming online, or test kits coming online. Do you find, are you confident right now as we look at this that we're solving that part of the problem?
Yeah, I mean, we have enough tests right now to begin to test the people who need to be tested. I think one of the things that's very important for the public to understand is not everybody needs to be tested. We're focused right now on testing healthcare workers and emergency responders. We're focused on testing people who are at high risk to have severe illness. Those are people who are older than 60. Those are people who have underlying health conditions. And then we're testing anybody whose doctor feels they really need to be tested. But most people outside of those at high risk are not at risk for a severe illness from this right now. And whether they're tested or not is not as important. What's important right now is the social distancing. And I'm looking forward to talking a little more about how we make that happen.
Well, let's get into that. And let me bring in Mark for a moment to also address the fact of what's happening with our nation's schools. Mark, I know that you have been focused in your career and work on trying to make sure that kids have an equal chance at school, that we have quality education for all students. And as we look at what's happening in New York, what's happening in Texas, what's happening in California, here in Washington, D.C., we see lots of students going out and being told, well, we're going to have home learning, we're going to have distance learning, we're going to have distance education. But we all know that that's an uneven playing field. And so I'd love to hear your concerns and guidance about the Stay at Home for Kids challenge.
Yeah. Well, at 50Ken, our focus has been how do we make schools work better for kids? And now we're in a situation where for 3 out of 4 kids in America, 37 million, out of 50 million, this week they don't have a school to go to. 37 states out of 50 have completely shut down their public education system. And so we're in a situation where ideas around home learning, online education that might have taken months or years to put in place, schools are now trying to put that in place in a matter of days.
And when you look at that, I mean, I just asked you, I mean, I was asking this question about whether America could pull off such a feat at scale just moments ago. Mm-hmm. I can tell just in the tone of your voice a great degree of doubt.
It is a very challenging time in education in America. And we're having to tackle a hierarchy of needs. So yes, we want to figure out how to get learning going, and we want to make sure that kids don't lose a full half year of education, but we also need to worry about how kids are going to get fed. There's so many kids in America who count on the meals that schools provide. We don't have that infrastructure. And how are we going to keep kids safe? There's so many kids who need that safe, protective environment of school. And if parents have to leave the home, are they leaving the home and leaving the kids there alone?
You know, Mika, you've been an early adopter, an early teacher, if you will, on online education. I've just read the 10 points that you recommend to people on how to make it work, how to make it a fulfilling, engaging experience. And I have to admit that I know people from kindergarten now through universities that are all of a sudden having to do what Mark just said and find a way through education online, which are new habits, and there are lots of doubts about it. But tell us what your early experiences have shown you about what society can do to make this challenge easier than it would otherwise be.
There is a huge difference between doing remote learning with advanced planning and what we're facing now, which is this reaction to a catastrophe. There's on all types of disasters, if you can think about it and plan and prepare in advance, you're always going to have an easier time. That's everything from having your bookshelves attached to the walls for an earthquake through to having a bit of a flexible learning plan for your classroom. Everywhere that doesn't have it is having to slam their classes up online as quickly as possible. And that means that you're not trying to replicate that teaching experience. You're just trying to get through. It has to be a very different set of expectations. It's not about, can we make a perfect learning environment? Perfect is the enemy of good on this one. We just need something functional. For my classes, even though they happen to be very well suited to be going online, I'm still reducing my expectations for my students for the next week at least while we go into this transition. I know a lot of them are not necessarily, they didn't sign up to be taking an online class, so they don't necessarily have the technology or the internet access at home. I actually ran a survey of my students to find out how many even had desktop or laptop computers versus how many are going to be accessing all of our course materials on their cell phones, and some who don't even have that sort of access and mobility to being able to continue their education.
Well, what is the answer then? I mean, I think, one of the things, I was in Ohio recently. In Ohio, the state of Ohio, for instance, has about 20% of its students do not have regular broadband access at home. A big part of Appalachia is there. When you look across the country, depending on your zip code, again, it comes down to zip code, you have very different levels of access to broadband and to internet to make this real. And so I'm wondering whether this notion of going online gets us as far down the road as we have, or whether we end up with, at least for the time being, an incredibly unfair and very uneven educational experience for children.
One of the first things we can do is go away from this idea of having synchronous education of everybody in class at the same time and move it to being asynchronous. So if you're providing, say, a video to go along with your course materials, instead of live streaming that video, which runs into problems if you have older technology or you have a more unreliable internet connection, or even if your household just has a lot of logistical challenges that are making it difficult to keep to a very strict and regular schedule, if you instead move asynchronously, you record those videos, you make them shorter, so you do a series of 5-minute videos instead of an hour-long video, then that just by itself makes it a little bit easier to be able to say, set all the videos to download overnight.
Right.
It's also important
I think that's a
that
great
this is
point,
not
Mika.
going to be a one-size-fits-all.
Well, that's interesting.
Yeah, I think that Mika's really right about this. I mean, we have to realize this is not going to be a seamless response. No parts of it. The medical and public health part has certainly not been seamless, and it's not going to be going forward. And some of these other pieces, we're just going to have to figure it out as we go along. And I think we can do that. I think we're a very creative and ingenious society of people, and we're going to figure out a way to get through this.
Well, Dr. Plescia, you've been somewhat, I wouldn't say critical, but raising questions that I found fascinating about whether the steps we're taking on closing schools actually solves the problem, whether this increases social stress and tension, and that the efforts now to deep clean schools are, I think to use your words, sort of wrong-headed at the moment. It sort of hits the wrong priorities. And I'd love to understand how you think we should be taking this challenge as opposed to just bandwagoning, let's shut down the schools. What would you say is perhaps, given what the science is, a more appropriate response for the times?
Well, first of all, it is really disruptive to shut down the schools, and that's what we're here talking about this morning, is how to deal with that, how to deal with the educational pieces. But I'm very concerned about the disparities we're creating, and also about the access to basic things like food. As Mark said earlier, many kids get their meals at school. I think we did, in the end, I think we did the right thing in the places where we're starting to see the schools closed. The question is, can we close them for a little while, try to get a sense of how well we're controlling this outbreak,
right,
and then maybe we can get to a place where we can open them back up. And we can open them back up doing some of the social distancing types of things. But I don't know how long that's going to take. I mean, 2 weeks, that's a little optimistic.
Mark, what are you hearing now from
in some
parents?
Ways.
Yeah, so I think it's really important to be listening to parents right now, because we haven't planned this. We're rolling it out. It has huge effects that we need to better understand. So, for example, getting food to parents. A lot of cities like Atlanta have created spaces around the city where parents can go and pick up food. But I talked to a mom who said she doesn't have a way to get to those places. She can't access the transportation. She can't get in a car. So how are we going to track what the implications of this are? We have kids coming home from different schools, and parents are saying one kid came home with 4 weeks of perfectly spaced out work, and one kid came home with nothing. And so there's these huge inequities that we're starting to see emerge, and we need to creatively problem solve around those. And we're seeing some companies step up and say, we'll provide free internet. We've seen districts like Loudoun County in Virginia that just made an emergency order for 15,000 Chromebooks to ship those off to parents. And we really need to approach it with this attitude of constantly listening to parents and solving problems.
Mika, you were about to comment.
So this idea of wait and see about reopening the schools, there's a problem with having too much uncertainty. With my students, I work with university-age students. One of the things that they needed was to know what to make plans for final exams. And that's a month away for my particular university. But making the decision of, we're staying closed no matter what happens next, allows everybody to prepare, to plan, to be able to figure out where do I need to be and what technology do I need access to in order to succeed in this class as it is. Yes, we need to be flexible along the way, but we also have to make some decisions instead of delaying them and delaying them and delaying them and say 2 more weeks out of classes, 2 more weeks, 2 more weeks, 2 more weeks. Because the more time we give people to plan and prepare, the better this is going to be executed.
I think that's exactly right, Mika. The uncertainty right now for teachers and parents is really difficult. If we don't think schools can actually open in 2 weeks, then we need to say that, and we need to start planning for the longer term. And that it's starting to feel like across states that this is not going to be a problem that goes away in a couple weeks. It's going to be months of disruptions for our school system.
I'm interested in all three of you, but Mika has something I will describe to you because I can't show it to you online right now, but it's a handwritten, hand-drawn sign. It basically says to her neighbors and folks in her community, do you need a pandemic pal? And it says, if you're high risk and limiting outdoor exposure, we can help. We have grocery delivery, dog walking, medical pickup. We're low risk and work from home, with a big heart from Mika. Mika, I'm interested in how this is being taken up, and I'm interested in the creative side, because there's a lot of talk about people pulling away from each other, social distancing, but we are communities. And I'm interested in the avant-garde, the the unusual, the innovative things that people are doing to hold society together. And this is one of them I've seen. What are you seeing out there? What's the response been?
There's a huge difference between social distancing and social isolation. One of the common factors in disasters is how well a community recovers has to do with its community resilience. If you think about all the good times you've ever had with your neighbors, if you've thrown block parties, if you have a neighborhood mailing list and you're all on the Nextdoor app together, if you go out to the volunteer firefighters picnic and have a giant fundraising festival each year, all of these things are like adding piggy banks coins into a piggy bank of goodwill. And then when you have a major social disruption, some sort of disaster coming through, a hurricane, an earthquake, a pandemic, you can smash that piggy bank open and have all that goodwill to spend out and that trust and social connection that you've built up. Right now, we're not in a situation where we can have parties because we're trying to have that social distancing. But I wanted to make sure to reach out to my neighbors, to the people who are geographically close to me, and see if there's anybody who needs extra assistance. It is easier to offer help than it is to ask for help. I did this on my community social media group, but I also know the highest risk populations are also those who are least likely to have secure access to technology. The elderly are not necessarily all online all of the time. The older you are, the less likely you are to have connections into the community Facebook group or anything like that. If you're poor and have less access to extra resources, you're not going to necessarily have a strong internet connection at home, might miss some of these things. So I made a couple of handwritten notes and I pinned them up in the high traffic areas of my community. And once I did it, a few other people also joined in and said, you know what, this is something I can also offer, which means we now have that backup resiliency. If I get sick, I can say I'm staying home, I'm not doing this anymore, but Diane's going to step up and everybody who I was helping support, she's now going to do. And that we can have that, we can all work together and we can all help each other out.
Thank you. Dr. Plescia, are there tricks of the trade from your arena? I think back to epidemics that I know you've also been near, SARS and other big reactions that societies had to deal with. I know that the reaction now in the United States is larger in this particular case, but what lessons came out of other experiences like SARS when it comes to how society can work together, what the building blocks of kind of knocking back the fear and uncertainty are?
Well, you know, it's challenging because I don't know that we've ever really faced anything quite like this. I don't know that we've faced this level of adversity in our country and our society because, you know, this is we call this novel coronavirus. This is new. It's not like the pandemic flu. The pandemic flu is a form of influenza. We have experience dealing with that. Maybe with SARS, some of the things are the same. You know, one thing that we've got to make sure that people do is remain calm. And I think what Mika was just talking about, you know, we've got to continue to be human and reach out and help each other out. And we can do that while still practicing social distancing. I mean, there's lots of ways to do that. You can check in with somebody on the phone. You can talk to them through the window. You know, and we've got to look out for people who are, who are older, who may be at much greater risk of getting through this. You know, we have to take faith in the fact that social distancing does work. I mean, we've used this in the past in epidemics like SARS and pandemic influenza. We've seen other countries use this. So, you know, we will get through this. And the other thing is, we need to really make sure, you know, we need to be very, very clear. People who are at risk, people who are sick or older than 60, we need to really be looking out for those people. But everybody else needs to stay calm and realize the chances of having severe illness from coronavirus are very, very low. And I think if we can keep that calmness, we'll do much better.
Dr. Plescia, when are we going to know that this has peaked?
Well, we're what we do to manage a situation like this, once we're really in it, we start monitoring what we're seeing in the healthcare system. That's the thing we are the most concerned about, is how many people are getting severely ill and requiring hospitalization and more intensive care. And we can monitor that right now. I mean, we call that surveillance. It's not testing everybody. It's testing very specific populations, so we can get a sense of, is this getting worse or is it getting better? That's what we're starting to watch now. We're going to see more severe cases going into hospitals right now. That's a given that this is starting to ramp up. But the question is, will that start to level out, where there's sort of a constant number, and then hopefully start to go back down? When it starts to go back down, that means we're in a very good place.
Well, thank you. I think in the last couple of minutes here, I want to ask each of you to talk to people out there that are in their homes with their children there, out of their schools. What are the things that they should hear and think about making this a more productive and constructive experience, not one that counts against their lives, but may give them opportunities that they might not otherwise have? I'd love to hear from Mark on this. And I'd like to say, too, this isn't just happening in the United States. This is happening all over the world, where you've got now in France, in England, and places in Asia, of course, complete systemic shutdowns of meeting places, of schools, of events. And so a lot of people in this social distancing process are engaged in something, and they are all spending time with children with different levels of access and different levels of resources. So I'd just love to have you talk to those people out there, Mark. What can help?
So I think the most important thing to remember right now is that kids need structure. So you don't need to make the perfect the enemy of the good. We want to help create a safe and protective environment for kids at a time when they might be scared. We want to figure out some ways where we can keep some learning going, knowing that it's not going to be perfect in the first couple weeks. And there's a social aspect to this, too. So kids are going to miss their teachers. They're going to miss their friends. So we need to think of some ways, while respecting social distance, that we can keep those connections going. And then hopefully we can find some things, in some silver linings here, where we're learning things about online learning. We're pushed into these new ways that maybe we can carry forward.
Great. Mika, let me get your snapshot.
So perfect timing, because I was going to say, one of the really nice things about this idea of having schedule is there's so many people right now who are stepping up and providing extra resources online for students and parents to access. So you can do drawing along live streams with a children's book illustrator at 1 p.m. Eastern time on Mondays. Or there's an entire series of Skype a Scientist classroom events where you as a family can book in and say, hey, we want to talk to a biologist. When are they going to be live streaming? And that we can ask questions. That there's things like Monterey Aquarium, they've shut down to the public, but they still have to care for their animals. So they've got feeding times for the otters on their webcam at 10:30, 1:30, and 3:30 p.m. Pacific every day, and you can tune in and watch that and have that be part of those structures
for sure,
and still get that extra idea.
Thank you. Dr. Plescia, I'm going to give you the last word.
Yeah, well, I am a physician. I'm a public health guy. So one thing I have to say is this very important message. If you're sick, it's very important to stay home. That is probably the most important thing you can do. Stay home, stay away from other people as well as you can. That's going to be hard. But the other thing I want to say is, and I think this is consistent with what we're talking about right now, we're all in this together. We're doing everything we can in the public health system to beat this thing down. The medical system is ready to act to take care of people who get sick, but we're all in this together now. I mean, people have to take the social distancing thing seriously. That's how we're going to really get through this. That's how we're going to really mitigate the potential bad consequences that can come from this.
Well, thank you for that. I want to thank you all for what you're doing. And thank you for being with us today. From Atlanta, Georgia, public health expert Dr. Marcus Plescia, and from Vancouver, Canada, science writer, check out her movies, Mika McKinnon, and in Washington, D.C., education advocate Mark McGee. Thank you all so much for being with us today.
Thank you.
So what's the bottom line? Everyone is hoping for the best, that kids will be okay, parents will be okay, grandparents will be okay, that food will always be on the table. But there are major challenges ahead. It's easy to say that American students can get their education online, but look at the debacle of rolling out coronavirus test kits. Doing anything at huge scale is political and often problematic, and there are real victims from government incompetence out there today. The bright side is that communities are banding together and social innovators are coming up with creative ways to help us with our well-being. There is hope, and that's the bottom line.